Okay, good afternoon, everyone. Thank you so much for coming today. I think from the chat, I can see people here that I know. I can see Zonke, who is from South Africa. I can see Dorothy from Australia. She's South African. So we've been communicating with other, I think over a year now. She's an occupational therapist. She's interested in dementia. Maybe one day she can talk about it. To the group, Matanda, a dear friend, colleague, from South Africa who is actually running a basic marketing foundation in Durban. And then obviously I can see Asiya, who is a carer known to BMF for maybe over 2 years now, a dedicated person who usually attends all these what you call webinars. And I have Kim from Glasgow, whom I know very well. So welcome to today's webinar. I think before I introduce Nompilo, who is a clinical psychologist, I think for me it's very important to acknowledge that dementia is a very, very difficult illness to deal with. But at the same time, I can say that a lot of people are doing their best to care for their loved ones. And even though it's challenging, but they try to think about positive things that they can do with their parents or their relatives. Of course, some of them, their parents are no longer here, but we remember how it was like to make sure that they live well with the illness. But I think we don't talk much about what is it that keep people going when things are very difficult. And now and again, we do touch on spirituality, faith, and things that keep people going. And I think today it's wonderful that we are going to be able to talk about this subject through the Nompilo's presentation. And I'm hoping that it's something that we can talk more about, because in our line of work, psychology or therapy, these are the things that people don't tend to talk about, but we know that for a lot of people, it means a lot, because that is what gives them strength to continue to look after their loved ones and have, compassion, empathy, all the things that we expect human beings to be treated with. So I think it's nice that today we'll be able to talk about it. And I'd like people to engage, after the presentation and ask questions about it, because there's so much that we can learn from each other. So, without further ado, can I welcome Nompilo? Sorry again about the video, the technology, because sometimes the technology does let us down. So, but thank you so much, Nompilo, for your time and also your patience. And I hope people will be more understanding. If it doesn't work well, please be more gentle, be more understanding, be compassionate, be everything that we want it to be, and then sort of understand that sometimes we don't have control over this situation, so we can see what we do. Thank you.
Okay. Thank you so much, Mamzethu, for that humbling presentation, introduction. So I'm just going to be introducing myself just briefly. There's not so much to say about me at the moment, right? So I am Nompilo Khanyile. I'm a clinical psychologist. I am based at Apelsport Hospital. It is one of the district hospitals under Umgungundlovu district municipality. It is here in KZN, in South Africa. So that is where I am based actually. So I did my dissertation. It was on how the pastors understood dementia and how they render their pastoral care and support unto people living with dementia and their families. And I wanted to explore what are the religious practices that they put in place in providing the spiritual and emotional support to these families and the members who are affected by dementia. So this whole presentation, this is a disclaimer that I'm going to do. This whole presentation is is adopted from my research, okay, from my dissertation. Okay. And I am hoping that we are going to be we are going to be learning a lot and navigating the spiritual world or the spiritual conceptions of dementia. And I think that is going to also help us a lot when we are assisting families and dementia patients. Okay. So as I've stated that I adopted my presentation from my master's dissertation. I understood how pastors as religious leaders understood dementia and the role and religiosity in managing dementia symptoms and the religious practices, as well as to how they actually come in handy. So before I continue with my presentation, I would like to acknowledge everyone that is here. Thank you for taking your time and showing your interest in learning about this topic. I'm really humbled by that. So when we are looking at the brief outline, I'm going to briefly introduce this presentation, and then I'm going to be defining some terms. And I believe it is very important to also define what is dementia and the perceived causes associated with dementia or the risk factors. And then we'll be looking at the dementia care in a spiritual approach, and then the religious practices in dementia care, as I've stated. And also, I'm interested in looking at the interaction between spirituality and religiosity and the subconscious mind. In my dissertation, I didn't have a section where I was talking about the subconscious mind in itself, but I did discuss some processes that happen in the subconscious mind. So currently I'm teaching myself more about the subconscious mind and its function. So I'm not an expert in this. And therefore I'm hoping that at the end of this presentation, we are going to be having input from you. Maybe you are going to teach me more about how the subconscious mind works. But on my part, I would just give a presentation of what I have learned so far. But also, please do come forth with more, ideas around this concept of the subconscious mind. I'm hoping that you can still hear me. Can you please indicate if
Yes.
Okay, all right. Okay, thank you so much. So if we look at the world in its entirety, there are different people who come from different cultural backgrounds. This diversity of cultures, it influences their worldviews. It influences, it governs, the way in which they perceive things. And these worldviews and cultural backgrounds, they play, a crucial role in influencing how they understand concepts, the religious practices they adhere to, and the spiritual connection they seek. According to available research or previous studies, they view culture as something that governs, even our spirituality, our religiosity, and our worldviews, the way in which we speak, the way in which we dress, the way in which we handle ourselves. So in the health sector, where maybe most of us are operating in the health sector, we see people engaging in similar behaviors as well. So, for example, when a person presents with a certain illness, they use their cultural and spiritual perspective to define the illness. And they use their spirituality also to understand the causes of the illness. And it also determines the relevant treatment methods that they prefer to seek. It all comes from culture, right? Now, when we look at the South African context, previous research gave an estimation of 80% of the people who rely on spiritual and religious avenues in understanding concepts, including the concept of illnesses. Therefore, to me, and maybe to other researchers or even to you as well, this may mark the importance of the holistic approach to managing illnesses. And this involves the collaborative work between the biomedical and the spiritual healing avenues. So maybe just to explain as well that in my research, I was looking at Christian spirituality and Christian religion, because it is something that is dominant in our context. But I understand that maybe we come from different religions. So I would like that each and every one of us, let's just translate this presentation and this content to our respective religions as well. So I don't think that this is just, it solely speaks to Christianity. I believe that Buddha, Hinduism, the Islamic religions, maybe there are things that they are going to take home out of this presentation. So I'm going to try to be as neutral as much as possible, just to cater for everyone. So now let's just define some terms. You know, the first thing that I would like to, that is very interesting, is that one can be spiritual but not religious, and one can be religious but not spiritual. And, you know, there are people who can have, you know, both of these concepts. They can be spiritual and they can be religious. So they do coexist, but at times, in some people, they exist exclusively of each other. So we tend to use these terms interchangeably, but they are different. So when we look at spirituality, it is a process of seeking the connection with the higher power, with God, with the divine, with the sacred, whichever label that you want to put to it. And then a religion is the organized doctrines that are practiced in a one localized joint worship that is more like a temple of praise. And then throughout the presentation, you are going to be hearing me talking about religiosity as well. So religiosity is more like your personal preference into a particular religion, and you are adhering to and following those doctrines that are established within that religion of your choice. And then we have a biomedical definition of dementia, which is basically a deterioration of the brain function where inattention, memory difficulties, problems with orientation, linguistic difficulties, amongst other things, emerge. And I thought it is very important as well to give, you know, the spiritual and religious definition of dementia, of how spiritual communities define dementia. So this is how they understand dementia. Some define it as forgetfulness, the loss of mind, and aging. And some understand dementia to be a natural disease, it's a supernatural disease, whereby an individual presenting with this illness is under attack from spiritual forces. Another understanding of dementia is that it is a disease of the brain and the mind, but the soul remains intact and untouched by the illness. So I promise to discuss this, this brain-mind-soul interaction later in the slides. And then the perceived causes. This list here is not exhaustive. I would like that at the end of the presentation, we also, you know, throw in more points of risk factors to dementia. So spiritual communities may perceive dementia as emanating from emotional distress, depressing life events. And I remember that one of my participants made examples about children who are not respecting and children who are not respectful and who are, neglecting the elderly people, and even grief as well. It was defined as something that can be a risk factor. It is a depressing life event. And then also aging is a risk factor. And again, the spiritual forces are seen to be the risk factor. And with the spiritual forces, what do they mean about that? So they're saying that the reluctance in engaging in religious practices is believed to make the individual susceptible to psychological illnesses. So, however, the religious communities must treat carefully with this belief, as it may trigger stigma towards people with dementia. And in the end, they may be blamed. People with dementia, they may be blamed for not devoting themselves to spirituality and religion. So they really have to be careful about that. Now, moving on, religion and spirituality, they play a crucial role in helping people with dementia better adjust and cope with this illness. Reliance on religious and spiritual avenues has been an essential source for coping with both physical and mental illnesses. So available that I was using for my dissertation, they presented a positive association between religiosity and spirituality and coping with dementia. From their findings, it did state that those participants, because like they interviewed people, like they had one-on-one interviews with people, and they found out that people who were presenting with dementia symptoms, those who were highly religious and highly spiritual, they were seen to cope better with dementia. But those who were low, who were not that high in religion, who had low religiosity and low spirituality, they were found to struggle more with dementia symptoms. So there are two missions that the spiritual communities have. Number one, or the first mission, is to provide support to caregiver families by supporting their emotional and their spiritual needs. There's a book written by Sadok and Sadok, and in their dementia section, they stated that the carers experience a combination or a constellation of emotions. That is the love for the person living with dementia, the sadness that comes with seeing the person who was previously self-reliant, who had, highly functioning cognitive abilities, and now they cannot remember, the most basic things about their lives. And the caregivers also experience irritability. And that irritability can be coupled with impatience, right? So that irritability is associated with the role itself of being a carer. And now, because the caregivers, it's a truth that we cannot deny, that deep down within themselves, they do love their family members or elderlies who are presenting with dementia. So that love, after all the sadness, irritability, and impatience, love kicks in and reminds them that this is the person you were attached to. This is the person who was your good object relations. And then remorse starts kicking in as well. So sometimes we may find themselves taking care of their family members, out of remorse instead of out of compassion. So that is why they need a lot of help from anyone who's around them, even the spiritual communities, to just reprogram them into providing care out of compassion and out of love. Furthermore, carers may be unable to engage in social and spiritual activities and even self-care. And this may lead to isolation and a feeling of despair and lowered quality of life. So the spiritual communities provide them, they pride themselves on doing home visits and conducting or engaging in religious practices with these families. So you see, in my slides, somewhere in my slides, I think this is the first one, you are going to be seeing text highlighted in blue. There is actually an extract. It's the exact words or the verbatim interpretation, translation of my dissertation. So this is what one of my participants had to say about how they provide care. So this is what my participant said. He talked about the fact that when the elderly person reaches their state, things like this happen, right? So, that thing of things like this happen, they are telling the family that things like this happen. There is more of the containment and the normalizing of dementia. It is very important that when a person in front of you is discussing their difficulties, you have to normalize and contain them. And then he's saying that we teach them so that they understand. And then psychoeducation is rendered or conducted there. It is very exciting for me to see that, well, the spiritual communities, they are using, the same or the similar approach as the professionals in the psychotherapeutic field, in the psychology field, right? So the counseling that they are providing, the psychoeducation through normalizing containment and desensitization. And also, it may be a daunting task to provide care and support to a loved one suffering from dementia, while the household doesn't have, the necessities like food, good infrastructure, and decent clothing. A caregiver role, number one, is emotionally demanding. Number two, it is physically demanding. Three, it is spiritually demanding. And it is financially demanding. Therefore, when spiritual communities render home visits and contribute what they can, they help alleviate the burden of the disease. So the second mission that the spiritual communities have is to provide care to the individual now who is presenting with dementia symptoms. So now it is in the individual level. The last two slides, they were on the family level, and now we are looking at the individual level, where the community, the spiritual communities commit themselves to help sustain the spiritual and human essence within dementia patients. Dementia may be perceived as, let's just remember that it may be perceived as the growth that occurs in a backward manner. For example, when we look at children, they are assisted with basic things like bathing, feeding, and all other basic activities, right? So though dementia may be treated though dementia patients may be treated in consideration shown in children, they must always be afforded the dignity and respect of elders. Now, there is more of upholding personhood. There is more of us trying to remember what makes the person, right? They should be considered as a complete person. They should be recognized as person. On the spiritual context, these spiritual communities argue that dementia patients display spiritual connection, which proves that their relationship with their higher power is very much intact. One of my participants argued that they aim for spiritual revival within the dementia patients, and they use religious practices. So with that being said, a dementia diagnosis does not disqualify patients from being spiritually revived. They deserve the same spiritual attention and spiritual support as those who do not experience this illness as yet. And I'm hoping that when I'm saying as yet, I'm not scaring anyone. So now we are going to be looking at the mind, soul, and brain. Previous studies, they argued that people with dementia often find it difficult to understand what is happening around them due to the cognitive challenges that they are experiencing during dementia. So I found it essential to investigate how my research participants access these old people's deteriorated cognitions through the use of religious practices, helping them understand these practices, even though they may have lost meaning in basic things and have become detached from the world around them. Another researcher stated that society may perceive a person with dementia as experiencing a social death. You see, this point, it really, sat with me. And, this concept of social death, it is due to them losing their sense of identity, having forgotten about the important information about themselves and their loved ones. It is more like their personal archive has been sort of emptied. And therefore, they also perceive the society, the general society perceive dementia as an unending death. But then on the other side, the spiritual communities, they see or they pride themselves by seeing dementia patient as still valuable, as still treasurers. So therefore, the spiritual communities target the soul, right? Which is a focal point, right? The focal point is the soul, and it is believed to remain intact, and the soul is believed to become active when the individual is served with spiritual and religious practices. And the soul thus activates the brain and the mind, right? For example, when the religious practices are rendered, the brain, number one, is responsible for remembering what is being said, or the songs or the lyrics of the songs. And then the mind, it helps to interpret those remembered words and make meaning of them, right? And then the soul does gets uplifted. But the argument, remember that I was defining dementia, that it is not the disorder of the soul. So the argument here is that the soul is responsible for the effective brain and mind processes. The soul is believed to be an all-encompassing entity, and it plays a crucial role in better adjustment with this illness, right? So they are saying that without the aliveness of the soul in the individual, then the brain and the mind would not be able to remember and effectively interpret what is being said or what is being sang during the religious practices. So now here's the list of the religious practices that I've been saying, and those people who have been observing and rendering them, they find them to be very effective, right? So it is prayer, it is worship, the Eucharistic meal. In isiZulu, we call the Eucharistic meal isidlo, and I think in some spiritual assemblies, they call it the Lord's Supper, right? And then we have, the reading of scripture. It is also one of the religious and spiritual practices, right? So In some religious settings, they use the Quran, some they use the Torah, some they use the Bible, and some they use many more, the words that I cannot even pronounce myself. So there's many varieties of religious books or manuals that people use. Now, I am here now at this, the subconscious mind concept, right? And please do help me with more of your input on this one. So we receive the stimuli through our conscious mind. The stimuli converts into thoughts. And when we preoccupy ourselves with those thoughts, they are transferred to our subconscious mind. So therefore, through the repeated reading of scripture and engaging in praises, in engaging in praise and worship songs, people tend to develop thoughts and beliefs which then become parts of their day-to-day living and daily meditation. Their emotions and behavior are determined by this daily meditation. Consequently, there might be an alignment between the thoughts, the emotions, the behaviors, expectations, and manifestations. Maybe most of us, we have come across people from Asian countries who sit down on the floor and they are engaging in meditation. There are positive declarations that they are making in the process, believing that there is going to be a manifestation from the. So this also relates to that as well. So now, therefore, going back to a positive relationship between spirituality, religiosity, and coping better with dementia. When believers engage in religious practices, their conscious mind perceives these practices as their source of hope, as their source of positive emotions, and they are believed to also facilitate their quality of life. The subconscious mind perceives this information from the mind as the truth. There is an author by the name of Joseph Murphy. He's talking about, the role of the subconscious mind or the works of the subconscious mind. He's saying that whatever thoughts that you keep on repeating in your conscious mind, they submit to your the thoughts that you are repeating in your conscious mind, they go to your subconscious mind. And he's saying that our subconscious mind does not have the ability to critique anything. So for example, if you believe that you are not a good person or you should be blamed for everything that is happening, your emotions are going to respond to that. Your subconscious mind is going to make everything align in accordance to your repeated thinking patterns. This is more like a cognitive behavioral theory, if you may like to, to put it like that. And thus, now, due to people, having these beliefs that the religious practices are going to be their source of hope and positive emotions, they are found to cope better with the dementia symptoms due to the alignment that I've just stated just now. So this tells us that people's spiritual beliefs, they do not occur in a vacuum, but there's also a biological or a scientific process or the interaction of the religious practices and the biological scientific mind or scientific brain, and that the works of the subconscious mind are at play here. So I think it is very important for religious and spiritual communities to understand that whatever that they minister to people living with dementia and their families, they are ministering to the biological beings. And I think the practitioners in the medical sector when helping people and families um, suffering or affected by dementia, they should understand that they are supporting and providing care to spiritual beings. So it goes back to what I said in the introduction, that there's this importance of the collaborative work between the biomedical and the spiritual avenues. Now, moreover, religious and spiritual individuals rely on scriptures, and one of their as one of their religious practices, you know, out of many. I just quoted a sample of scriptures that could evoke hope and positive emotions, as I've been mentioning in the previous slides. These kind of verses, they are not just history from the religious book, but they appear to be psychological in nature. They are likely to alter how the person going through psychological adversity may perceive their situation and regain their hope. Maybe we may ask ourselves again of how can people with dementia remember and make meaning of biblical scriptures. However, as I've said, previous research and my participants, they speak of spiritual connection and revival. They perceive a person's spirit and their connection with the higher power to remain intact amidst the illness. They argue that before dementia, there's a seed, there is sown in the person's soul. And that seed is faith, and it is believed to be embedded or engraved in the person's soul. So during dementia, the soul is cultivated, and thus it helps the person regain their internal capacities of coping with adverse symptoms associated with dementia. And I'm just, you know, I'm just by the end of the presentation, but this is what I would like to highlight and put an emphasis on. So some researchers who have concluded that there is a positive relationship between spirituality, religiosity, and better management of dementia argue that people with dementia may forget about the divinity and their relationship with the divine. Their memory loss, it may fade or erase such narration. However, the divine is believed not to forget his people in his everlasting mercy and unconditional love. And there is a researcher, his name is Wendrobel, and I quoted his article mostly or quite significantly in my dissertation because he had, you know, very insightful points. He targeted one of the residents, right, where what can I call it, more of an old age home, and he served them with some religious practices, and his discovery was that I think maybe Mamzet, you will remember that Dr. McCarthy, in our last week's presentation, he talked about the tactile objects and how they trigger memory. So when Robel as well, he discovered that tactile objects or verbal stimuli were likely to trigger memories about the divine and how the elderly should handle themselves in humble adoration of the divine, right? When spiritual communities render these religious practices, they help people with dementia remember who they are to the divine and the divine's love toward them, thus gaining hope. This remembrance, as aided by the religious practices, it signifies or marks the importance, it marks the profound hope for those who are demented, who now in the divine become remented and reminded and therefore remembered. Therefore, this also signifies hope in spirituality and its role in assisting with the management of dementia. There may be a shift from being demented and move across the spectrum and be remembered. And the concept of being remembered to me has twofold meanings. I don't know about you, but I would like to hear more from your side what you think. One, a person living with dementia may know that they are remembered by the divine, as Wendrobel did say, right? And then another way of looking at this being remembered, right? It is being reinstated into their previous social position. And what do I mean about that? Or what do I mean by that? If we go back to how the society perceives people with dementia, saying that they have lost their social position or they are facing the unending death, those perceptions lead people with dementia to be often forgotten by the society and no longer perceived as active members of the society. Thus, religious practices have been found to assist the elderly to assume or maintain their social position and be remembered as active members of the society, meaning they are made to be valued members of the society. You know, when you are being removed from your social position and then now you are seen as not an efficient member of a certain society. So the religious communities, through the use of the religious practices, they sort of like pull you back. They pull dementia patients back to being members, active, valuable, and treacherous members of the society. So to me, it is more like you are being remembered. It's like you are not forgotten, but also you are being remembered. You are being reinstated back into being the member of the general society. So that marks the end of my, I hope, brief. I hope it was a brief presentation. So thank you so much, Mam Zetu. I'm going to hand the platform back to you.
Thank you so much, Nompilo. What's a beautiful presentation. And I really would like people to feel comfortable to talk about how useful it was, or if maybe they've got any questions that they want to direct to Nompilo, please do so. But I think for me, the takeaway from this presentation is nothing to do so much whether people are spiritual or religious or not. It is about us as human beings to remember that somebody living with dementia is still a person. And Ubuntu is something that we really have to think about, remind people. And I think the religious community or the spiritual community, especially in South Africa, I'm not going to talk about other parts of the world, they have a role to play in actually reaching out to those people who no longer come to church, those people who are marginalized, those people who are kept at home because their relatives feel embarrassed about bringing them to the church because they may behave in a way that may be embarrassing to them, or they may not think that they understand what is going on, or they may think that just because they've got dementia, it's just that death. And for me, the word death, it's kind of a very strong word, because you may still not remember certain things, but the spirit never dies. People will still be able to connect it, just like love. You may not be able to talk, you may not be able to speak, you may not be able to shout and remember, but when there's love around you. When the environment is nurturing, respectful, you respond. You do not have to talk, you do not have to remember everything, but then you'll be aware that the love and respect, is there around you. And I think, I'm speaking as a South African here now, not just as a clinician. I think, in South Africa, faith or religion is something that's very important. It's helped people to cope with so many things in life. But I also would like to see more of this community reaching out to people who are marginalized. And I think they have a role to play. And I really would like to see us working closely with people in the position of power, the pastors, the priests, or whatever you want to call them, to stand there in front of the congregation and actually saying, how much do we talk about dementia in our communities? What is it that we are doing? How do we know that we're actually doing what we should be doing as a community? Because it's very easy to talk about these things, but then I see little evidence of people going out there and saying, let's have a church where we invite people living with dementia and we make sure that it's dementia friendly. We make sure that people can be supported when they come to church. People are not going to be taking pictures, putting them on TikTok, laughing about them, looking at their behaviors. How can they be respected? Families are likely to come to church knowing that it's a church that is going to think about people with dementia, and families can feel confident to bring their loved ones because nobody's going to make fun of them. And I think we have, a long way to go in our communities, which, I think it applies to all communities, but I'm going to sort of refer to people in South Africa. But I think this was a wonderful presentation. I think we need to talk more about the faith, the importance of faith, helping families, carers, even carers, forget about the person living with dementia, how they have to continue to care despite the challenges that they're facing so that they can continue to have compassion and still look after themselves. I've said too much. And I really would like people to make some comments if they really would like to. But thanks again, and Nompilo, for a wonderful presentation.
Okay, thank you, Mamzethu. Thank you so much. I'm seeing a comment from Samsung SM, and he's saying that people with dementia actually participate very well in religious practices. I'm going to make, two examples. One, remember, Mamzethu, when you were having a workshop, the BMF day in Durban last year. You remember that there was a choir there of the elderly people with dementia.
Oh, yes. Yeah.
When they were singing gospel songs. I remember what they did was they showed us through the use of their body language that they know what they are doing, they know who they are singing to, and they know what these songs that they were singing meant, right? They were raising up their hands, they were pointing upwards as they were dancing, and they were fully engaged. When I was looking at them, I was busy having flashbacks of, what I've read when I was doing my dissertation. I was like, okay, I saw this in my dissertation, but then now I'm seeing it, practically so. You see, so she's correct by saying that they actually participate very well in religious practices. And another example that I have, last year, my sister, she had a stroke. She was having cardiac issues in the past, and she was treated for this. They were just managing it. And somewhere in August, she had a stroke, right? And after that stroke, she displayed, cognitive challenges, and they were also coupled with, a bit of hallucinations here and there. She couldn't remember our names. By her luck, when she remembered, our names, she would just confuse our names. She couldn't recognize that she was at home. She thought that she was just in a hall somewhere. But at night, when it was time for a prayer night before going to bed, she would be singing along with us, and she wouldn't miss the lyrics of the songs. And she would be praying, like you would understand her prayer. And I remember that I'll be very naughty and then start, lowering my voice and trying to, see if her prayer is logical. And it was logical. So unfortunately, she's with God now. She passed away on this very same date, on the 6th of October. So, but then, like I could see that Norman spirituality and the works of the soul, sometimes we cannot really understand how they work. They are mysterious at times. It's just a phenomenon. So yeah, I do agree with this comment right here.
Thank you so much. Is there somebody want to say, just to respond to that comment about people with dementia actually participate very well in religious practices? But when you talk about dementia, we're talking about people with dementia, but other people may not even have any mobility at all. They may not even be able to speak. They may not be able to do anything, but there's still something, because if maybe they were familiar with, particular songs or any kind of religious practices in their own way, they may just listen. They may not have to do anything, but if you look at them, you can tell that they actually understand. So sometimes you cannot see it visible, but then just like a song, some people may cry and they feel something, and maybe that song reminds them of something. So that's kind of communication. People do not have to be responding by verbally saying something, but a lot of things can happen through non-verbal communication. So, taking someone to church, they may be on a wheelchair, they may not even be opening their eyes, but they'll still listen, they're still connected somehow, even though we can never actually be sure how they are, connecting with spirituality, but the fact that they are there, and then you can see with the body movement that they're responding to it. So I think, it's just, for me, the message here is that we have to reach out to people, and in one way or the other, and not just think that just because they've got dementia, they won't understand. But people with dementia, obviously, some can still go to church, others can't. So the ones that can't, we reach out to them in one way or the other. Yes, Madanda, you want to say something?
Yes. Thank you so much, Nompilo, for the presentation. It's something that is so dear to my heart. When my mother was diagnosed with dementia, number one, even being in the medical field, I didn't understand. So you get through different emotions, you are overwhelmed, and you are told there is no cure. The next step is, then what do I do? From the spiritual perspective, I'm a Christian, and for me, the only place that I could go to was to God. There's a scripture that I always use now when I talk to people that have their loved ones with dementia. I like 1 Corinthians 9. It's just one. I mean, 1 Corinthians 12, verse 9. This is when Paul spoke to God so many times and said, for God to remove the thorn in the flesh. Now, for me, the thorn in the flesh, it can be something that is so painful, something that is like poking. So the thorn can be even dementia. I took it as the thorn, it's dementia, because we understand what dementia is. So when Paul was asking God to remove the thorn, but God did not remove the thorn. God only said, for my grace is sufficient for you, and my power is made perfect in your weakness. So I had to hold on to that for me and for my mother to live well with dementia, I need the grace of God. So how I get that grace, of course, is to connect through prayer, is to connect through reading the word of God. Because what is in front of me, which is a thorn, there's nothing else that I can do. So I need to make sure that I continue to live, but show dependence or depending on God to take me through. I also want to comment when you're talking about do the pastors understand about dementia? I mean, as Zetu has mentioned, is that sometimes the families are too embarrassed even to share or to tell the pastor that my mom is living with dementia, because they are worried about the behavior, they're worried about the symptoms, that the mother can just out of the blue start saying something right during the church service. So the pastors will not understand if, one, people like BMF don't raise the awareness. Number two, if the families share with their church members or the church families that my mother loved the church or my father loved the church, and there's still that connection spiritually, so that, there is so much. When people come to BMF offices, the first thing that I ask the family, what was mom's church song, favorite song? So that song, I'm going to sing with them. Same as what I used to do with my mother. So the minute you sing the song, you can see the person living with dementia joining in. Though not all the words will come out of that song, but you can see the movement. You can see it's like you have taken them to another level. So we need to educate people to connect and to still take people to their churches, different churches, or it can be a church, it can be a mosque, it can be a temple, so that they continue with that connection spiritually. So no, yes, I understand, and thank you so much for your presentation.
Thank you, Ma'am Happy. Thank you for your input. Thank you.
Nompilo, I just have a question. In your dissertation, how did you reach out to those people? And since then, what is it that has happened? Have any of those pastors or the church members shown any interest in learning more about the illness, or encouraging the community to to reach out to the church and get some support or something? Because I'm just curious, really, because we can talk a lot about what is it that we need to do, but dementia is an everyday thing. Every day people are living with this illness and they need that kind of support. And but for me, then I still believe that not just the church, everybody's responsibility is it's to be able to protect, to love, to educate the community around dementia. How much, since you've done that work, has anybody shown any interest in what is this illness about? Like Madanda is actually saying, how do we understand it? Or is it something that people maybe shy away from, but they can talk more about, comfortable about spirituality, but not really want to know much more about the illness? I'm just curious.
So in my dissertation, what happened was that it was a qualitative study, right? So I just reached out to 6 pastors around Pietermaritzburg. I didn't interview any family members. I didn't interview other, congregants or the people living with dementia themselves. No, I didn't interview them. It was just the pastors. Out of the 6 pastors, I've been in contact with one of the pastors, and from time to time, he just send me WhatsApp messages or he calls me. Sometimes he does come at home and he would be asking me about what is happening and asking, some follow-up questions about dementia. It's like he is hungry to learn more about this illness. But for the other ones, I've lost contacts with them ever since. The last time I had a conversation with them was that time when I was doing my data collection. It's just one, that I'm still in contact with.
Mm,
Mm.
interesting.
Yeah. Yeah.
Sorry,
Sorry, can I come in?
Yeah, please, Matanda.
Nompilo, this year I've attended a funeral, 2 funerals
Mm.
of people living with dementia that has passed on, and the families wanted me to come and speak about dementia. And the reason was because one of those family, the mother, you have that being ostracized, discriminated,
Mm.
and they were saying, what this is now the Christian community, the things that they were saying. She's mentally ill. She's being bewitched, or is a witch, and all those things. So I had to come in to explain about dementia and the symptoms. And also, I've just been invited in the Methodist Church here in KZN and at Claremont. I've been asked by the church to come and talk about the dementia because they want to make sure that people who are living with dementia and their families still come to church services. As you have explained, there has to be that spiritual connectivity. And our elderly, that's all that they do, was to go to church, was to pray. They teach the children, they teach their grandchildren. So if we as families stop them because we don't explain to the church about this sickness. So it was very interesting because after that, Zetu, I told Zetu, I was getting calls left, right, and center for some of the churches to come and speak about dementia. So there's a lot of work. Like I said in the beginning, we need to encourage the families to take or to go and explain about dementia to those pastors, or even invite us, BMF, to explain further about this illness.
Yeah. 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 I believe that what you are saying right now, it is very important. If you look at provinces like, is it the Western Cape or the Eastern Cape? A number of elderly people have been victimized, and some lost their lives in the process because they were accused of being, it's like they are
Yeah.
performing sorcery.
Mm.
They are bewitching other people, in the environment,
Yes.
in their vicinity or in the neighborhood, and I think the problem with dementia is that as it affects the cognition and the social judgment and all that, and it affects the orientation of the individual. Sometimes they get lost, within the house, and then they just find themselves wandering, around. And some people, they go to bed, you understand that. They go to bed naked. So now when you are found wandering outside and you are naked, the first thing that the society is going to think is just gather stones and some fuel so that we can just light this person up, because this is the sorcery that she is conducting here at night. So I do believe that churches, I'm thinking even of schools as well, raising, young leaders who should be well informed, about these things. It is very important. NgesiZulu, they say ugotshwa usemanzi. So I think we should also be targeting schools.
Yeah, we are.
In the near future, those people will be making decisions.
Well,
They are growing up, they are going to be making life decisions.
well, like Matanda is saying, we have been doing this for many years in South Africa. With no support whatsoever. Even the church community haven't been receptive. It may take months even to get 10 minutes of your time just to come and reach out to people in the community. But at the end of the day, the government has a role to play. Unfortunately, they just don't, there's no willingness to do anything about it. And we can sit here and speak for hours, me and Matanda, and especially me in particular, where, you know, living in England, you know, having to deal with South African government, all the government departments, there's just no interest whatsoever. But I believe that sometimes we do not have to wait for the government because whether they think about us or not is another story. It is about us as a community to help each other. Whatever little information that you have, you know, it is about you sharing with your neighbor, with the next person to see how can we help each other. As a community, we can help each other, then expect other people to do it. For me, it's like, what is it that you can do as a person? Then, oh, people should be doing these things because you can, I mean, I read a lot of articles, people talk about in South Africa, you know, awareness is very important. How then do you do that? Where do you start? It requires resources. It requires people who are dedicated. It requires people who've got the passion. We survive through BMF because the carers who've lived this experience, they know the impact of dementia on their families. I wouldn't have done that if my mom didn't have dementia. I was just happy working with children's mental health. But because it's a personal thing, that is why we are where we are today. But then you also want your community to be able to learn more about this illness. But then I'm hoping that from here, somebody else is going to say, okay, I learned something today, or this is what I really want to do to help my community. Support us, helping each other, then expecting the government to come in because they're not going to do it. And they have to deal with other issues that they consider to be important, even though we believe that more people are dying from this illness, but there's very, very little that is being done. But I think it is us as a community, we have to, you know, take up this cause and deal something with it. Zonke, you wanted to say something? Sorry. Yes.
Yeah,
Yeah.
like I will make an example esontweni lami.
Yeah.
People they worry more about umuntu uzo interrupt service if they bring them to church. They worry about that more than for someone to interact. I enjoy na service. So kwamanye amabandla benza ama-area pastor akuvakashela ogogo emakhaya just to give them a communal service, isidlo.
Yeah.
Holy communion, yeah. Bafika opastor emakhaya babavakashela ogranny just to interact with them emakhaya. Kodwa futhi nakhona uyabona ukuthi ama-family members are ashamed more than supporting ugranny.
Yeah. Thank you.
That is the problem. So uthola ukuthi esontweni ugogo uyajabula. Mina ngiya-understand ukuthi ugogo uyajabula, but i-family member, hlala phansi gogo, hlala phansi uyaphazamisa esontweni, hlala phansi gogo. You know, that type of thing.
Yeah, it's true.
Yeah, and it
So
is a very saddening truth, Zonke, because remember that even though a person may be suffering from dementia at that time, at that moment in time, but they are still human beings, you know. And as humans, we were created for community, you know, created for societal, what can I call it? But you know, the communism. We were not created for individualism. So now, if you box the person and just keep them in confined boundaries of the walls in their homes, then you are not allowing them to serve the purpose of the purpose of the communism. So it is very disadvantageous. I understand that in the churches, they may think it is beneficial to render the Eucharistic meal within the home environment. But hey, now, you know, they have to go and see other people. They have to go and acknowledge the beauty of the world filled with people. It's very important to be cognizant of that.
I mean, well said. But I think we can only do whatever we can. For me, whatever small, I always think if I can make a difference to one person in South Africa, that's good enough for me. I don't expect to change the whole of South Africa. I don't expect to make a difference to everybody in South Africa. But if I can make a difference to one person, that's good enough. And I think for me, it's very much about that. the stigma is an issue that we're struggling with as a society. Even here in England is also a very big issue, but in South Africa it's even worse because we've had people in our own group, 2 people's parents were murdered less than 3 years ago because they just happened to wander off, and then another one, it was during the day. She just got lost. Her daughter came back, mom had gone at SASA offices in Durban, and she was found murdered, strangled, raped in a bush somewhere. And the police have never had any interest whatsoever to follow up the case, even today. No interest, because it was an elderly person. I'm sure if it was a child, they make an effort. I even tried to follow it up and I just gave up because it was just a kind of attitude, even from the police force, because it's an elderly person, right? They don't matter. And then I think as a society, it's something that we have to deal with because we are old, we're getting on, and then it may be us. One day, we may just develop a dementia because there's many people are living with this illness, but people hide it, and I can understand, but the nurses also, the first point of call, like the clinic, they dismiss people. Just go home. It's an old age problem. What else can you do? There's nothing else you can do. So even the people that's supposed to help us, they don't have the knowledge, they don't have the understanding, they're not trained in dementia. Even the doctors themselves, they do not know much. So I think for me, as a community, we don't have to be a specialist to know about dementia, because people can access it at a very basic level so that they can actually understand the symptoms and know what they do. So that is why BMF is here, to be able to support people. How are we supported by the community ourselves? We are not. And then I think Matanda can say that we are not. So even though we're supposed to be a community, we're not, because people tend to think more about themselves. They don't think about the next person. And I think we, unfortunately, are living in a society where some people, not everybody, obviously, we just don't consider others. We only think more about ourselves.
Yeah, true.
Okay, so if then, I don't know if there's anyone who needs to say something before we wrap up.
Oh, yeah. I want just to share, Pastor One made an effort once. Remember when there was the COVID-19?
Yeah.
So most of us, we lost our parents at the very same time. So akazange zathola ukuba ne-one-on-one nathi. So wasiqoqa sonke sishonelwa abazali in one hall, wasilethela i-clinical psychologist. Yafika yase-Hillcrest, sengikhohlwe igama lendawo. Yafika shem yazosiconsola, and I wonder if niyabona yini basinikeza lamakhandlela lawa abhala ukuthi in the memory of the Russians is blessed, like basinika lamakhandlela just for ukusiduduza thina esasishonelwe. Shem, he did make an effort, but ukuthi sonke salahlekela omama nogogo at the same time. Shame, but shame abanye, they are really trying. Trying.
Yeah. I'm sure
I'm
sure there are religious communities who are going out of their way, who go above and beyond to assist families affected by dementia. And when I'm saying people affected by dementia, I'm not just talking about the patient themselves, but I'm talking about the family, because they get to experience the difficulty that comes with caring for a person living with dementia, right? So yeah, that was a very good effort on their end.
There are good people who do a lot of good work out there in the community. But I think, we just have to continue talking. And one way of actually learning more about this illness is to continue to have these meetings. And if people want to have some particular topics that they feel very strongly about, please let me know, and then I can get my colleagues to come and do some presentation. And I think maybe in the next week or so, we will have one that will be focusing on the behaviors, the challenge, the behaviors that people are concerned about, the ones that make people rush to the doctors to saying, my mom is not sleeping, my mom is aggressive, my mom is smearing feces everywhere. So those behaviors that are difficult, we call them behaviors that challenge, because obviously they are behaviors that are difficult for a lot of people. So I think we should be having that in the next 2 weeks, and also just to focus more on mental illness in older people, because we don't think that just because you are old, you may not experience depression or have a bipolar condition or schizophrenia. So I think it's so important because, again, it's very much around the stigma around mental illness, anything that has to do with the changes in the brain. People obviously then think that people are no people. They are just not human beings. So I think it's very important for people to understand that it is an illness that can be treated, even if it's dementia, which can be treated, but you can still live well with the illness as long as the carers have the support. So Matanda is in South Africa. She's doing a fantastic job. I don't know where I'll be without her. Thank you so much, Matanda. And if people really need to talk to her and maybe wanting to refer families who need to understand what this illness is about and how to manage it, she can tell you because she has a lot of experience personally and also professionally, and she can be able to support the families. And yeah, so thank you so much again for coming today. So hopefully I should see you in a week or 2 weeks' time. Thank you. Good evening.
Thank you.
Thank you.
Yes. Okay. Thank you.
Zetu,
Yes.
I just wanted to share an observation.
Okay.
But now that you've closed, maybe some
Okay.
other time.
Okay. Okay.
Like on Fridays when I fetch my aunt, so we walk, it's about under half a kilometer. And then there's just some people that she just connects with. And I think it's just she reads their souls more than I think it's just the soul. So it's like the soul becomes like, what guides her now. And then some people will greet her and then she'll just look the other way. So I don't know if it's just like the behavior change but it's something that I've noticed, many a times. And just to say that I'm Muslim, so today during my afternoon prayer, so there's a ritual where we greet the angels. So I just said, Salaam alaikum wa rahmatullahi. And then
Walaikum
she
salam.
responded. She responded and she said, Walaikum salam. Because what I do, if it's time for me to pray, I will pray wherever she is. So at least that she knows where I am and then she sees me. And, many a times that she will respond and she'll read the, sort of like the equivalent to the Lord's Prayer in Arabic.
Yeah.
Yeah, so
I know.
Mhm.
Bismillahirrahmanirrahim.
Bismillah.
Yes, yes, yes. I think people underestimate it because the brain works in a very funny way because you can never know which bit of the brain has been affected. But I think we all know, even for people who may not know much about dementia, if you consider a child that has no language, right? Okay. And then you look at the child and you pick the child up, you smile, right? Okay. What does the child see? She sees something that is very positive, somebody who's smiling, and the child will respond by smiling. And then when you touch the child, with love, the person will respond. But then sometimes with adults, obviously people with dementia, you never know. People are always surprised when they come up with something because people just did not understand that, how I thought you maybe got dementia, who know about anything like that. But you can never know how a person is going to respond, how much they can still say or do. But I think for me to make sure that you create an environment, especially around spirituality, when we know that our parents, our grandparents, this is what they knew, and you just create it and just leave it there, you'll be surprised how they respond. Just like with music, you do not have to sing, you do not have to know the words, but who knows, somebody may just come up with these words and just, say those kind of words. But then because if we know that spirituality and faith is so important, why do we deprive people? Why do we think that just because somebody's got dementia, they may not understand? It is about us. We are the ones who've got to change. We're the ones who've got to change our attitudes, and we're the ones who've got to encourage other people to understand that just because somebody's got dementia does not mean that they have to be defined as somebody with dementia, because they're still people. They've got experience, a lot of experience. We can learn so much from them. They may not be able to tell us exactly, what they used to do, but they have so much to offer. And we just have to treat them with compassion and love. which is what we try to teach.
Yeah.
Thank you so much, lovely group. Thank you so much.
Thank you. Okay.
Thank you,
Wonderful
Zethu.
to meet with you guys.
Okay.
Hopefully you're gonna
Bye.
see you soon. Bye-bye. Yes.
Bye.
Bye.
Bye, everybody.
Bye.